Dr. Rogers, give us a little background on yourself and your experiences here at the Mobile Infirmary.
I'm Dr. Max Rogers. I'm an OB/GYN in private practice in Mobile, Alabama. I've been in private practice for approximately 11 years, and prior to that, residency and medical school at the University of Alabama in Birmingham. I've been doing suburethral slings for approximately 6 years now, and it has been a tremendous addition to my practice. And being able to provide that service to women suffering from incontinence is a huge enjoyment to me and certainly to the patients. I have utilized the trans-obturator technique pretty much since its inception. And approximately 2 years ago, I transitioned to the connoisseur needleless suburethral sling manufactured by Neomedic. One of the major reasons that I transitioned was because the traditional trans-obturator approaches left you with either a dissection tract or a puncture through the actual obturator membrane out through the skin. And the leg pain associated with that was just an added inconvenience to the patient. And what I've found with the connoisseur needleless sling is that you really don't have any of the leg pain. In fact, rarely, if ever, do you have any pain whatsoever if you utilize some local medication at the time of the procedure.
Can you give us a little insight as to your transference to utilizing needleless for your patients?
One of the tremendous advantages to the connoisseur needleless sling is the fact that it is a single incision obturator sling. And I think it's safe to say that at this point in time, the obturator slings are the gold standard for stress urinary incontinence in the United States. The obturator approach has proven to be equally as effective as the previous methods utilizing a suburethral sling, and the connoisseur needleless sling proves to be equally as effective in my practice as any of the other obturator approaches that I've used, and I've used a number of them. As I mentioned, the fact that you have a single incision cuts down on the pain, but what is unique regarding the connoisseur needleless sling is the fact that you have equal surface area to other larger slings that go all the way through the obturator fossa. What this does is allow for greater tissue ingrowth, creating a stronger neoligament or support of the suburethral area. So again, in my practice, it has certainly been equally, if not more effective than the TVTO.
And can you maybe share with the audience what your patient selection criteria is?
As far as the patients that we will select to actually insert the connoisseur needleless sling into, any patient with documented genuine stress urinary incontinence is an excellent candidate, regardless of their age or body habitus. In fact, this is a fabulous sling for a young mother who is working, who doesn't have the time to take off. It's likewise an excellent sling for an older individual whose social activities or normal daily activities have been interrupted by continuous stress urinary incontinence. Fortunately, the efficacy is not affected by body habitus. It can be inserted and is equally as effective in women with a body mass index greater than 35. For all patients with genuine stress urinary incontinence, it is very effective. In the event that the patient has a severe case of third or fourth degree prolapse associated with or with a large component of intrinsic sphincter deficiency, at that point I would use an adjustable sling as opposed to the connoisseur needleless.
Dr. Rogers, can you give us a brief explanation of what we'll see in surgery today and a little bit of the long-term experience for your patients?
What we're going to be looking at today in the operating room is the connoisseur needleless sling. This is essentially the sling. One of the great advantages is there's no kit associated with it. There's no extra equipment, which is good not only for the operating room staff, but the hospital as well, because it's very cost effective. All that you need is a tonsillar forceps. This one does happen to be made by Neometic. One of the advantages of this is a marking on it, which gives you alignment along with the center of the sling itself. The sling has approximately 15.5 square centimeters of surface area, making it the largest of its type and very comparable to any of the TOT, and in fact, greater surface area than the vast majority of the transobturator type slings. And again, that gives you more strength and more tissue ingrowth and a stronger knee ligament. The sling actually has two pockets at the end of it, which are actually utilized to place the forceps into. And I will demonstrate that later on in the operating room. But when it's actually inserted into when the sling's actually inserted through your single incision, which is mid-urethral, it's aimed up at the 10 o'clock and 2 o'clock position, placing it right behind the inferior pubic rami. Again, the placement is simple. There's no exit puncture site and very little leg pain, and in my opinion, predominantly because you're not actually going all the way through the obturator foramen and into the obturator externus, which appears to provide most of the pain that the patients with other transobturator techniques undergo. That is the arrangement in its final configuration. The stay suture should be right aligned in the middle. I will point out several techniques that make the actual insertion of the sling much easier and will facilitate it. Generally, we're looking at a procedure that lasts from 7 to 10 minutes, even if you're taking your time.
I think it would be beneficial if you could share with us the pre-op and post-op for your patient care.
As far as my experience with the success rate in my patients with the connoisseur needleless sling, I would have to say that my experience is superb, and I have been extraordinarily pleased with the results, not only immediate results, but the long-term results as well. One of the results of my getting into incontinence at the very beginning of my experience with the transobturator slings was what I referred to as the hug factor. There was nothing more gratifying than seeing a woman 6 weeks after surgery who came in and gave me a hug and said, "You have changed my life, and for the better, and thank you very much." I can honestly tell you that hug factor was not there with all of the smaller slings that I have used, but that I am extraordinarily pleased with the results of the connoisseur needleless sling. Those hugs are still coming. And in my experience with the connoisseur needleless sling, of which I've placed approximately 140, I have been extraordinarily pleased. One of those patients has had to undergo a redo, but in retrospect, I believe she also had a significant component of intrinsic sphincter deficiency at the same time. Again, I'm very pleased that there is long-term data, greater than 2 years now, that substantiates it, and I'm hopeful to contribute my own patients, my own patient population into accumulating more of that data.